Braun lecture at the University of Lucerne. The Life B. Braun lecture, wow, okay. Now, I just start. Dear guests, it's so nice to be such a big room today. And the Life B. Braun lecture is part of a collaborative initiative between the University of Lucerne and B. Braun. And we are sincerely grateful to B. Braun for their continuous support and commitment to advancing reflection in this crucial field. I must say that today's lecture could not be more timely. At a moment when science is increasingly contested, when public health decisions are scrutinized through political lenses, and when trust in institutions is under pressure, the relationship between law, public health, and democracy demand careful reflection. It is a profound honor to welcome Professor Gostin to Lucerne today. Professor Gostin is internationally recognized as one of the leading world scholars at the intersection of law, public health, and human rights. As distinguished university professor at Georgetown University, the highest academic distinction awarded by the institution, and director of the O'Neill Institute for National and Global Health Law, he has helped shape not only academic debate, but also the legal and ethical architecture of public health systems around the world. His career reflects an extraordinary depth of engagement. In the United Kingdom, he played a central role in reforming mental health legislation, contributing to a framework that wants to protect civil while ensuring access to appropriate treatment, an approach that helped destigmatize mental illness and influence the Mental Health Act of 1983. In the United States, he ruled the drafting of the Model State Emergency Health Powers Act in the wake of 9 September, navigating the delicate balance between collective security and individual rights. He has advised the World Health Organization and co-chaired the Lancet O'Neill Commission on Global Health and the Law, advancing the understanding that law is not merely a regulatory instrument, but a determinant of health in its right. Professor Gostin is an elected member of the National Academy of Medicine, a fellow of the Hastings Center and the Royal Society for Public Health, and serves as global health and legal editor of JAMA. Yet, what is more striking about his work is not the list of distinction, and I could keep you here for 1 hour to mention the distinction, but the intellectual consistency that runs through it. A commitment to grounding public health action in ethical reason, democratic accountability, and the protection of human dignity. At a time when the authority of science is challenged and public health measures are scrutinized through political lenses, Professor Gostin's scholarship reminds us that law is both a safeguard and responsibility. It structures power, but it also protects the condition under which science can save society. Just to cite a very recent paper, on February 16 Lancet commentary, Professor Gostin and co-author strongly criticized the 2026 US dietary guidelines, arguing that they depart from the independent scientific advisory committee evidence-based recommendation and were shaped by a less transparent and potentially conflicted process. We are very grateful that Professor Gostin has accepted our invitation, and we look forward to learning from his insight. Please join me in warmly welcoming Professor Lawrence Gostin. But, and there is a but, because I pass the microphone to him, I would like to invite my colleague and friend, Professor Jerome Bickenbach, who has told me you have 30 seconds.
30 seconds, folks. Well, as a Canadian, I thought, it's going to be difficult as a Canadian with introducing an American because he may want to annex me, and I would. But what I want more seriously, at one point in my life, a human rights lawyer, and these things, human rights, universal rights, solidarity, rules-based order in the world, human dignity, caring for people. These are such vague, amorphous, fragile considerations that we talk about and we adhere to, but actually in recent days we know the concrete consequences on human lives of ignoring those values. And one of the great benefits of having this gentleman speak to us and his discussions in JAMA, the Viewpoint and the Health Forum articles, which I recommend to you, is that this gentleman is on the coalface of telling us the concrete results of ignoring the fragility of these universal values. What happens when we discard the notion of individual human dignity, when we disrupt the notion of equality? What happens when those values are corroded? There are concrete consequences, and this gentleman is one of the people that is addressing those. So without further ado, Professor Gostin.
Hello, hi everybody in the back as well. So I think, is that on? Okay. I think I'd probably be better off without it. Can you hear me without this? No? Okay. I don't like it. So I'm going to talk about science, the rule of law, and democracy. But really, in contrast to what you've just heard, I probably won't talk too much about the concrete issues. I'll really talk to you about the importance of love, caring, and serving a community, which I think is extraordinarily important. So my talk is going to be looking at science and public health that are under attack. I'm going to look at quality health information and why that's withering in our society and what we can do about it. I'll then drill down a little bit about vaccines as a particular issue of importance now in science. And then I'm going to transition to the scientific method and why science is misunderstood by society. Then finally, I'm going to look at science and equity and the interchange between scientific information and the dissemination of that information and scientific innovation compared with the equitable access to the fruits. And then I'm going to just include by looking a little bit about the ethical values of the common good and of decency and compassion for one another. And I think at the heart of what's happening in our societies today is the breaking of the fabric of this, caring for one another. Our political leaders, particularly mine, not to put too fine a point on it, is vile. Greed, power, the powerful can rule seem to be the realm of the day. And that's not the way human beings can live and thrive and flourish and have well-being. So mis and disinformation on health is rampant today. We see it amplified by artificial intelligence. Populist governments are perpetrating false health information. They're fueling anti-science beliefs. And when truth is debatable and science is undermined, democracy and the rule of law are significantly threatened, as you say, fragile. We've also seen withering attacks on freedom of expression, academic institutions, and even free and fair elections. And venerable scientific institutions are crumbling under a strain of populist assault. In this troubling era, it seems to me it's critically important for us to stand up for science, democracy, the rule of law, and human decency. And that's really the message that I want to leave you with today. So let me drill down on some of those areas, if I may. One of them is quality health information. I'm the co-chair with Professor Rubinellis on our commission of the Nature Medicine Commission on Quality Health Information for All. And I've just finished a JAMA article on that subject. We argue in that JAMA article that quality health information is a core determinant of health. It's just as important as other deep-rooted determinants of human health and well-being, such as socioeconomic determinants, education, areas of commercial determinants, legal determinants, that are so fundamental to the ability of human beings to live healthy and productive and longer lives. I think it's no secret that health information is under withering attack. We see it in social media. Traditionally, people got a lot of their information in clinical interactions between doctors, nurses, and patients. But now, very little of our information is coming from the clinical setting. Most of us are getting our information from social media, our mobile applications, and through internet searches. Much of this is now being amplified by large language models, generative artificial intelligence, and the algorithms that many of these platforms use are intended to actually uplift false, nasty, brutish information over truthful information. This includes AI-generated images and videos, what we call deep fakes, which makes it extraordinarily difficult for any of us to accurately distinguish between high-quality information from false and misleading and actually quite damaging information. This affects every realm of human well-being. It affects our diet, what food choices we have, what medicines we choose, what nutritional supplements we have. It makes people wonder about their own self-image, whether they're beautiful or handsome. It can encourage hatred based upon race or gender. It can, at its most extreme forms, it can lead to self-harm or actual harm to others, both mental health conditions, suicides, depression, and harmful conditions, or even violence, including firearm violence and sexual assaults and violence. These are not the kinds of things that society, none of us want to live like that. It's just not in the nature of human beliefs, values, and yet we're doing it, and we're doing it to ourselves. And of course, a lot of these AI-generated images and messages are intentionally shaped in ways that make it very hard to understand and separate the real from the unreal, particularly with real-time feeds. And it's also, I think, particularly harmful to young people, children, adolescents, and young people who are shaped because of the way that these images and messages are generated, particularly to grab attention, to keep attention, and shaped by human perception and how we look at our world. I don't know why any young person would listen to a social influencer about what they eat or their physical activity or how they look, but that seems to be what's happening today. We need to somehow lift up messages of truth, of kindness, of compassion, and of decency, and rather than suppressing them. So we're doing the exact opposite of what we need to make us all happy, productive individuals, families, communities, and societies. It's really a very, very troubling time that we live in. Let me talk about one particular. Oh, wait, I did want to mention one other thing. In terms of our ability to distinguish between false and misleading health information and truthful information, we used to have what I call kind of safe harbors, places where you could go and you could actually trust that the information you're getting is actually based upon some reasonable methodology, reasonable evidence, and a sincere attempt to arrive at the truth. That's not to say that these safe harbors always arrive at the truth, but at least they start with the premise that they will use the best methodology and evidence to do so. And I think that's critically important. I know all of my life, when I really wanted to find out anything about health, diet, disease, injuries, mental health, I would go to the United States Centers for Disease and Control and Prevention website. It always gave me the kinds of things I need. But now, under somebody called, it's hard to believe, Secretary Kennedy, the wonderful name of John F. Kennedy, Jr., the idea of the CDC website has been completely contaminated in so many ways. Blazoned across the official website of the vaccine page, it states, for example, that the statement that the CDC has made for the last 20 years that vaccines do not cause autism is not based upon information and evidence. Shocking. And I'll explain why that's literally a fraudulent statement by Secretary Kennedy. It's not figuratively fraudulent, it's literally so, and I'll explain that. At the same time, the Advisory Committee on Immunization Practices has completely transformed what we've done. They've taken all of the vaccine scientists, they fired them all, and they replaced them with anti-vax conspiracists. I personally recently had dinner with the director of the National Institutes of Health, the most venerable bio research institution in the world, traditionally. And my job was to convince him to increase funding for global health research. I thought I did a good job, but within the next week, I got a letter from Secretary Kennedy firing me. The letter just simply said, "You serve at the pleasure of President Trump, therefore you're no longer wanted." I suppose that's an honor. So I've talked a little bit about vaccines, and as we speak now, for example, Canadian measles elimination status in Canada has been discontinued, stopped. The United States, Mexico, and other countries are soon, probably this year, going to lose their measles elimination status. Childhood diseases like measles, mumps, smallpox, all entirely preventable diseases, are now spreading across Europe and the world, Africa, India, Asia. And these are entirely preventable. We may even see a reduction in polio vaccination, threatening the World Health Organization's polio eradication initiative. And a very good friend of mine, none of you will know him because he was such a gentle giant, just died, Bill Foege. I have a tribute to him coming out in the Milbank Quarterly. Bill was single-handedly responsible for the eradication of smallpox, the greatest scourge in human history. And he did so in ways that were the exact opposite of the leadership that we're seeing today. He was modest, he was kind, he didn't want to have he didn't want to be the center of attention. And so, for example, when he went to India and tried to eliminate the last remnants of smallpox through what he called a ring theory of vaccination. They were about to announce the full eradication of smallpox. But before they did, he decided to leave India because he didn't want to take the credit away from local communities and local leaders. Now that's leadership. It's not what you're seeing in the White House. It's not what you're seeing in many European capitals. But that's really the nature of what a leader does. Now, I mentioned before that the idea of vaccines and autism is literally fraudulent. Let me explain why. So where did this idea come from even? It came from Andrew Wakefield, a physician in the United Kingdom. He published a paper in The Lancet, the world's highest impact medical journal, showing the link between MMR vaccines and autism. It turns out that his data were literally fraudulent. As a result, the Lancet withdrew the article and made a correction and an apology. Andrew Wakefield lost his medical license in the UK. Since that time, the National Academy of Sciences in the United States, and I was part of that, had a 3-year study showing there's simply no link between autism and vaccination, and yet it continues in Europe, continues in the United States, and now it's promoted even in the highest levels of the United States government. Most recently, the President of the United States got up and said that there was a link between acetaminophen and autism. Where he got that information from, I have no idea. Actually, I do have an idea, but I won't tell you where. And so we see that these perpetuation of not just misleading information, but false, malicious, and fraudulent information is now accepted by wide swaths of people around the world. The most troubling thing is that science itself is under sustained attack. A lot of this, but not all of it, originated during the SARS-CoV-2 pandemic. During that time, science appeared to get things wrong, including the World Health Organization, the CDC, the European Medicines Agency, and many others. Things like masks were debated. At one time, the World Health Organization recommended against using masks. I know why they did that, but it was a mistake. And it was also the long period of time it took before public health agencies recognized the aerosolized spread of SARS-CoV-2, because previously it had been thought that it more resembled the epidemiology of influenza, which is a droplet spread. That's why this whole idea of a 6-foot rule, that you had to stay 6 foot from one another, took hold. That was wrong, because literally the virus was aerosolized. That meant it was suspended in air, and it could be from here to the top of there. So science appeared to get things wrong. And to be sure, many of our best scientists didn't do a great job with health communication. What they should have done is said, this is what we know, this is what we don't know, and this is what we're trying to do to find out what we don't know, and we will tell you as soon as we find out. But instead, they had an air of certainty. So in so many realms, the public distrusts science. They said, well, you were wrong on issues of COVID. And actually, they think, you're wrong on diet. You used to tell me to eat butter, not margarine. Then you told me that margarine was bad. Then you told me that meat was bad, and full-fat dairy, and cheese. All the Swiss love cheese. That's bad, too. But the real issue isn't that science can ascertain the truth. Science is a method. It's simply a method of trying to understand the world, to understand science. And it's a very imperfect method. It's a method that is evolving. It presents theses, it tests them, it retests them, it refines them. Sometimes it contradicts them, but usually it's additive and it gives you greater and greater certainty the more evidence that you get. And while science is not a perfect way to understand the world or to make decisions about health, I just don't know of a better way. Certainly, Trump and Kennedy don't have a better way. They say, well, this is what I believe. This is what I've heard. So use bleach and it'll get rid of COVID. Take ivermectin and that will cure you. Acetaminophen causes autism in pregnant women. Vaccines cause autism. You just make it up when you go along. And so, do I say science is perfect? No. But I think the public misunderstands the scientific method and what it's trying to do. I would rather live in a world where we were guided by two things. One are basic human values. The human value of decency, of telling the truth, of caring for others, for compassion, and for the capacity to love on the one hand, and then to use some rigorous method to constantly improve our understanding to advance human health and well-being. That's the world I want to live in. It's not the world I do live in. I used to think that liberal democracies were better able to deliver on those two promises. I used to think I lived in a liberal democracy. I don't think I do anymore. And it certainly doesn't correspond to me, to the values, and to the scientific evidence that I would like my world to live in. I want to talk a little now about science and equity, because even before COVID, I always believed that the greatest global social narrative was the narrative of unfairness, of inequity, of inequality, of injustice. This was true in the idea that the 1% of the population owned 99% of the wealth. But it became painfully true, and it hit the world really hard during the COVID-19 pandemic. And it was most acute about the equitable distribution of the fruits of scientific knowledge. Vaccines come to mind. When the United States, almost all European countries had, and certain Asian countries like Japan, had almost universal access to the COVID-19 vaccines. Things like messenger RNA vaccines by Moderna, Pfizer, and BioNTech, or AstraZeneca vaccine or others. They had everybody in their population, not just their most at-risk populations, having access to these vaccines. But at the same time, if you went to sub-Saharan Africa, or if you went to Latin America or other parts of the world, even frontline health workers, ambulance workers, firefighters, sanitation workers had no access to the vaccine. They were the ones at greatest risk. And this was true also with diagnostics, with personal protection equipment, and with therapies like antiviral therapies. And so this was a real world lesson about inequities. And they weren't accidental inequities. Sometimes you think, well, the rich are just able to purchase it. But in this case, rich countries, think Switzerland was one of them, but certainly most European countries, I'm almost sure Switzerland was as well, pre-purchased vaccines. That is, even before they came into the market, even before they were approved by federal regulators, the European Medicines Agency, the Food and Drug Administration, and others, the UK regulatory agencies. Even before that, they pre-purchased the vast majority of the global supply of vaccines, which meant that when the World Health Organization started the ACT Accelerator and the vaccine arm of the ACT Accelerator, which was COVAX, they had the machinery and the design to distribute vaccines worldwide, but they couldn't purchase them because there weren't any available. And so inequity triumphed over equity. And that's likely to continue now. I see nothing that would lead me to believe that we would do better next time. And in fact, I see a lot that makes me think that we're going to do even worse, particularly with the rise of national sovereignty, populism, my country first. And so one of the greatest examples of this kind of looking at the idea of equity on the one hand and scientific innovation on the other is in the World Health Organization pandemic agreement. I worked very closely in drafting both the international health regulation amendments and the pandemic agreement. And I'm currently working closely with WHO and member states on what is being negotiated in Geneva right now, which is the PABS annex to the agreement. PABS meaning the Pathogen Access and Benefit Sharing System. I've called this in the journal Nature the great social contract, because it looks at the two of the most fundamental issues that we face in the world. One is our drive for more and better scientific information, driving innovation. Now remember that it used to take at least 10 years to develop a vaccine. And sometimes we never get a vaccine, like we don't have one for HIV/AIDS, even still. But normally the lag time was about 10 years. The quickest we ever did it was 4 years with mumps. And yet, mRNA vaccines and the AstraZeneca vaccine were developed in less than 1 year from the first outbreak in Wuhan. And CEPI and other international agencies are developing platform technologies that we hope will be able to develop a vaccine within weeks or months of the next pandemic striking. But even that is under threat. So, for example, the National Institutes of Health in the United States under Secretary Kennedy decided to disinvest in messenger RNA technology and invest in the link between autism and vaccines, exactly the opposite of what you should do. So PABS says that you need to have full open exchange of scientific information. These are pathogen samples, genomic sequencing data, and other digital data, surveillance, epidemiological information, outbreak reporting, which are critically important for scientific innovation. You can't develop the vaccine unless you know very quickly what the current circulating strains are. But at the same time, once we get that information, we need to be able to produce the vaccines, the treatments, the diagnostics, and then to equitably distribute them around the world. And so some people ask me, which is more important, the science or the equity? My answer is simple. We need both. Both are essential, and they're not necessarily in conflict. They should be synergistic. And that's what the PABS agreement is trying to do. That's why I call it the great social global public bargain. And the reason it is because the global north wants scientific open exchange, the global south wants equity, and we need to have both. And they can't be a tit for tat. I give you this only if you give me that. They're both independently important. So with that, I really want to end with the idea of values. Because in the end, despite all that I've talked about in terms of vaccines or even information and the quality of health information, or about the attacks on science, all of that is really, really important. But to me, it pales in comparison to the importance of our deepest human values. These are universal values. They're values that apply everywhere in the world. So all over the world, even in Africa, even in Asia and India, and countries that tend to have a more communitarian system, there's an erosion of these values. You could see it in India, for example, with ethnic attacks and including the leader of the country in supporting these kinds of things. But you see it everywhere. But you see it mainly in so-called liberal democracies, where the idea of me, what I want, what I need, what I can have, what I have the power to get, and that's the thing that's the most important. And we've really lost the tradition of the common good. It's not that individualism isn't important. It is. We all have basic integrity. We all have basic autonomy, and we should. But it's gotten way out of balance. We have to stop asking almost exclusively, what does everybody owe me as a rights-bearing individual? What can I have? And we have to start asking, what can I do for my family? What can I do for my friends? What can I do for my community, my nation, my world? What that's about is more about compassion, empathy, understanding, caring for the other. In my mind, a world built on equity, justice, and solidarity, based upon shared democratic values, is a future that really is worth fighting for. But perhaps a better way of saying all this is that we must reject selfishness, indecency, and dishonesty, and embrace mutual obligations, compassion, and love for one another. And that's what we need to do as a world. That's it.
Hello. Thank you very much, Professor Gostin, for this. I would say it was a journey, and now I have the honor to open the discussion with a question to you, Professor Gostin. In your recent JAMA article, you emphasize that science must remain the foundation of public health policy, yet science alone cannot resolve political and ethical trade-offs. At the same time, we are witnessing declining trust in institutions, increasing polarization, and a fragmented global information ecosystem. From a global health perspective, if trust and shared knowledge are the infrastructure of public health, what happens when that epistemic foundation itself becomes unstable? And how should the next generation of global health professionals position themselves within this tension between science, democracy, and societal trust? Thank you very much.
Thank you. It's a wonderful question. The truth is I would start by saying that scientists and public health and global health advocates and venerable scientific institutions, like the World Health Organization and the CDC, all of us, I would urge to start with modesty, be humble, have humility. I have argued, and I think quite strongly, in favor of science, and much of the work that I'm doing today is standing up for science. But science alone is not enough. That's what I was really trying to get at, and I was glad you asked the question because I meant to say something in my talk about it, but maybe I'll just take just a minute to reflect on it. I'll start with the idea that, let's say we want to solve a problem of health and humanity. For me, I would want to start with science. I don't understand why people would not want to know what the evidence suggests. So in the United States, for example, even before COVID, before Trump, before Kennedy, before all the horrible stuff, Congress decided that the CDC couldn't do research on firearm safety. Now, I don't understand why a policymaker wouldn't want to know what causes firearm suicides, violence to others. They may decide in the end that there's some other value, but why wouldn't you want to start with what the evidence tells you? Sometimes policymakers, and I understand this, and scientists sometimes are too defensive. Sometimes you might say, for science tells you you should do X. Does that mean that the body politic needs to do it? No. So for example, let's suppose, it's got a grain of truth, but not total truth. But let's suppose that closing schools, science tells us closing schools during a pandemic saves lives, it saves the health of children, it saves their parents and their grandparents. And therefore, we should close schools. Or that we need to do a total lockdown, as almost every country in the world did, to preserve our hospital and health system. That's what science tells us. If I were a leader, somebody deciding for my country or my world, I would want to know that. I would want to know what science tells me. And most of the time, I would probably do what science tells me. But I can entirely respect the idea that somebody might say, okay, closing schools will save some lives. But I don't believe it's worth the trade-off with the loss of education and the opportunity. So health isn't the only value. There are other values. Same thing with, lockdowns or close downs. Society is entitled to make decisions based upon understanding of that the knowledge and the evidence is. They would want to know, what does the evidence tell us? How strong is the evidence? How durable is the evidence? How severe and probable are the harms? And I want to trade them off against other social and human values. That's what we elect political leaders to do, and we hope they do it in a sincere, honest, decent way, intending to safeguard the health, the well-being, the education, and the thriving of their societies. Unfortunately, we're not seeing any of that. And that's one of the reasons why there's just crumbling trust, not in just science, but in political leaders writ large.
Sir, I have a question regarding the Gates Foundation, of the work of the Gates Foundation. What are they doing in this new world? Are they stepping up to the plate? I'm asking this because historically the Gates Foundation has been very active, proactive in the distribution of vaccines in the global south. What do you know about their work today?
I'm not sure, which foundation is this?
Gates, the Bill and Melinda Gates Foundation.
Oh, the Gates Foundation.
Yeah.
Yeah.
Because they used to do a lot in that area. There is now like a vacuum where I would think they could step up with the funds that they have.
I have worked and do work with the Gates Foundation. They're basically focusing on their core priorities. Vaccination is one of them. And so they give a lot of support to Gavi, the Vaccine Alliance, to CEPI in developing these platforms. They do give funding for childhood immunizations and delivery of vaccines, but they're not prepared to kind of step up and fill the hole that's been left by the abdication of global health funding, particularly by the United States, but not only. You're seeing it in Germany, that's lowered its global health funding, in the United Kingdom and in many other countries around the world. I think Bill Gates has taken the position that he's not going to intentionally try to fill that gap, but really reinforce the last, they're sunsetting after about 20 years. They're going to spend all of their money, and it'll be on kind of mostly scientific innovations. They basically like, which I agree with, high technology, low cost, high impact innovations like sanitation and toilets around the world, which can make sense to me. But I think the simplest answer to your question is no, they're not stepping up into that gap, to fill that gap. I think you're going to...
Maybe I can jump in here from an academic perspective. You have taken a very American perspective.
I don't think it was very American perspective at all.
Let me talk about the trust in institutions. You said that's one of the most important aspects, that people can get the information from trusted institutions. You are not able to judge everything that you see yourself. I would say that the trust in institutions is still existing in Europe. I would say it's existing in this country. For example, we have the Swiss Academy of Medical Sciences, a very trusted organization. I'm not an American, but I'm a member of the National Academy of Medicine, a member of the National Academy of Sciences that you meant. This academy, in my view, as of today, is independent. This academy is publishing workshops. We had a workshop here 2 years ago on aging, functioning, and rehab. There was no influence by anybody, and everybody has access to that information. So I would challenge a little bit with this. It seems like Professor Bickenbach always says, I'm the half full and not the glass half empty. So in terms of the glass half full, in the US, even in the US, you have institutions of highest trust, such as the national academies. Do I err in this, or would you say that even the national academies as independent bodies cannot be trusted anymore in terms of information, health information?
Well, I trust the national academies. I'm not sure it has very large public trust. No, I don't. And even, as you might be aware, the academies have been under withering attack, even by its own members. There have been a lot of letters that have gone on. But I think that the idea of loss of trust in institutions, you're absolutely right. It isn't universal. And as I said earlier, the United States is the epicenter, but it's not the only one. There has been a number of global surveys I've published as part of a big group of scientists, and some of them that showed that trust in institutions everywhere is crumbling, that it's going down. As I say, it's not universal. I'm sure that the Swiss Academy is trusted. I have no other basis for saying that. But I do know that I was recently in Berlin at the World Health Summit, and I talked to the health minister there, and I talked to members of health ministries across Europe. And I asked them the question. I said, the US CDC is suffering from this. There's all the vaccine stuff. What are you seeing in your country? Their answer to me was, we're maintaining it, but it's very fragile, and we can't tell you that it will survive the next election. They're not at all confident. And if you look at the European survey data, there is, across Europe, a lowering of trust in science and public health institutions. In fact, the only place where I see science having very high approval what surprised me was in South Korea. The South Korean CDC is now the highest trusted institution in Korea. But yes, you're right. I totally see the point that we are, the United States is the worst and the most horrible. I'm not denying that at all. And I do think that you can't generalize how people see trust in institutions. But overall, I do think that a lot of the trust is vanishing because, or at least it's eroding, but particularly because people are getting their information not from the national academies or the Swiss Academy. They're getting their information from an influencer. They're getting their health information from a bot or from some other place. And so it's not the old world. It's a new world. We're going to have to adapt to it. But yes, I totally see your point, and it's a very fair one.
Hear me? Okay. Thank you, Larry, for your input. My question is in the context of health being kind of having a market asymmetry and trying to use market-based mechanisms. This week, there was an interesting case here in Switzerland where the Federal Administrative Court basically asks now the Federal Office of Health to open up contracts linked to vaccines purchasing. They were released, but 90% of the documents were redacted. And now the Federal Administrative Court basically said, no, that's just not right. They might still bring it to the Supreme Court, but from a signs of trust, how does this feel when my own public health office at the federal level doesn't show me?
Yeah, the whole redaction idea I get with the Epstein files at the moment, where they're redacting the perpetrators, but they're not redacting the victims. So, yes, I think that is a big problem. We actually saw that during COVID. One problem that I mentioned was the governments that were pre-purchasing vaccines, and we never really saw what those purchasing agreements said. But another is that into the epidemic, a year or two or three into the pandemic, companies like Pfizer, BioNTech, and Moderna were selling their vaccines to vaccine-scarce countries, particularly in Latin America and Africa, and they were asking for really usurious terms, outrageous terms, but none of the, including sovereign wealth guarantees, things that were just totally outrageous, but they were all private. And ProPublica and other international media institutions were able to get some of these contracts, but transparency is a very big issue. I think transparency is necessary for good governance, but it's not sufficient.
Okay, so I understand that the lower trust in science is a broad and complex issue involving a lot of political decisions, but I would like to ask you, from your experience, would you have any advice to give to early career researchers or people who work in the academia that maybe from our position and whatever maybe we can do from that, anything could be done differently so we could gain back some trust from the public? Thank you.
Well, I believe that you, the youth, you're the future. You're the ones that are going to make the difference in your country, in your community, in your world. It's not going to be me or my generation or even generation below me. It's going to be young people. Young people they're the ones that are going to have to live in a world of global warming. They're going to be the ones that are going to have to live in a world where many people have sacrificed the next generation for the current generation. And you're going to be the ones that are going to be the scientific, public health, global health leaders. And the only advice I would give you is to stand up for the values that I had suggested and find solutions to achieve those basic core values, and understanding that you have enormous challenges for your generation. I mean, my little grandchildren, I do fear for them, living in a world where we don't really know what's next in terms of what artificial intelligence and large learning models are going to bring us, where climate change is getting ever worse and we're not doing very much, if anything, about it, in some ways harming it even more and more and more, where honesty and decency are not dominant. So I think You will set the tone, and you'll figure out a way to do it. And I know, I hope that you'll do it better than my generation has done, which has been my generation on the whole. What I see is a lot of selfishness.
Thank you for a fantastic lecture. And I wanted to just say I dedicated my public health lecture introduction to our medical students in Bern yesterday to Bill Foege. So I loved your tribute. I wanted to go a little bit more into global health, which I'm teaching next week. And it's about the complexities of international aid. And despite the absolutely unconscionable withdrawal of the US suddenly from all of its obligations, there is, I wonder what you think we could have done better to help countries like Sub-Saharan Africa and India to take on the responsibilities of the funding of vaccines and international health that we've tried to push, but we kind of left this gap of dependency, and how we could have got over that better.
Yes, it's very important and a large question. Part of the framing of all of this is that the US, Europe, UK, and others should be doing more, and they shouldn't, and they've cost millions of lives by withdrawing international assistance. And those millions of lives have been pretty much documented in modeling and in experiential points, and that's really is a horrible thing. But I think we're now at a transition point. We're at a pivotal point where we have to reimagine what so-called global assistance looks like. This is an oversimplification, but essentially the kind of Western model, it's a vast oversimplification, but I think it's basically true. The Western model of international assistance, Europe in particular, the United States in particular, was a model of philanthropy, charity. This is what we're giving to you out of the goodness of our heart. That was never a very good model. It assumes that we're the benefactors and you're the grateful recipients. And we're actually seeing this now, particularly in Sub-Saharan Africa, where countries are saying, maybe it's a good thing the United States is stopping this. We don't want to be so self-reliant on Europe and the United States. We need to rely on ourselves. Same thing is true with India. I mean, you could say the Gulf states, India, China should give more to international assistance, and I would agree with that. But that's not solving the fundamental problem. The fundamental problem, I think, is self-reliance and not being dependent on others, and how we can achieve that so that countries can develop their own vaccines, to create their own robust health systems and achieve universal health coverage and the like, are primarily national and regional, but there's also the importance of international solidarity. But as I think the younger generation is going to have to figure out, what does the next model look like? I don't like the China model, which I didn't talk about, but I don't like the China model. I don't particularly like the Western model. But now we have an opportunity to reimagine what that world would look like, and we need to do some careful thinking about that, because we just don't want to go back to status quo ante, where the next Democratic president starts to flood the world with aid. That's not going to solve the fundamental problems of human well-being around the world.
So thank you very much again, Professor Gross. We have something very Swiss, and when it opened the present, I have a few instructions for you, and then you will see what he can inside.
What I hope it's not. Tedros once gave me the most beautiful Swiss Army knife. He took it away from me at Geneva Airport. I never could see it.
You have to open this one.
This one.
I have so thank you very much for being here. I have a few instructions. We have now lunch for everybody. We have a buffet outside here. And for the master and bachelor student of our university, you have voucher for going to the Mensa, which you can just collect outside. For all the other, Professor Gostin will stay with us, so you have time for more questions. I think we have a lot to think after this today. Thank you very much. We wanted, what is best.
This is a perfect gift.
Just to show Swiss. Thank you very much to everybody. Thank you.